So thanks for listening, everyone. And this time we have a great clinician. And as you know, this is one of the favorite times of the program that most people give us great feedback. And it's really when we get to talk to clinicians who are out there in the field, day in, day out, in the trenches, as they say, dealing with patients. And the great thing about clinical practice is there's a lot of theory and there's a lot of techniques and different strategies, and the clinicians get to try them all. And the neat thing about that is they find what works and what doesn't. So today we're very honored to have Dr. Dawn Cormier speaking with us. She's a licensed naturopath from just outside of Stratford, Ontario. And her training is in health science and naturopathic medicine. She's a certified birthing specialist, and she's worked in the field for over 19 years. She's married to a chiropractor who does acupuncture, laser therapy, and matrix repowdering. And she's also worked in multiple different clinics that have these multiple discipline practices. So she gets to work with patients and other clinicians and have that full comprehensive outlook on the patient. So with that, welcome, Dr. Dawn. A pleasure to have you here.
Thank you, Robert. It's a pleasure to be here.
Yes. And this time, we're going to talk about something that's very close to your heart and that affects so many different people. It's allergies.
That's right.
So can you start and give us an overview of allergies? Because many people are probably going to think this is like seasonal allergies. So maybe start with that and explain all the great things that you do.
Okay, well, when I got into practice some years ago, it became very clear within the first year that allergies, or what we call more uncommon allergy symptoms, were at least part of the picture in 60-70% of the clientele coming to me with chronic conditions. Allergies, when they first came in the scene in medicine, was about 1906 or something, and that was in conventional medicine. They used to define allergies as something called altered reactivity. But it's really, I think, become quite the epidemic. And most people don't even realize that some of their chronic conditions can be based in allergies. And when we can identify them and treat them and heal the body, their health just soars. It really does. And so what I'd like people to get to understand today from our talk together is that allergies, especially in the pediatrics and young children coming up in this generation, don't overlook the potential of allergies that are affecting your child's health. There's red flags you can look at, but when a child starts out the gates with a weakened immune system and allergies, they're just set up for dysfunction. And I'd like people to get to know how to identify them and treat them and make everyone's health better.
Awesome. You said two things that kind of keep my interest. You said allergies are related to many chronic conditions. Can you give us, our listeners, an example of what that might be?
Oh, that's a great idea, because allergies can be pretty obvious, right? We have our common allergies like asthma, and we have anaphylactic reactions to certain foods, or like bee stings and peanuts and things like that. Someone may, eat a certain fruit and break out in hives. These are actually what we call our type 1 hypersensitivity reactions. They're immediate. You know when you have these allergies. People come into my office, they already know. They're written down on their allergy form. They're good. But what most people don't really understand is things like headaches, migraines, bedwetting in children, chronic colds, gastric upsets, like anything from constipation to diarrhea to irritable bowel and cramps, and even, of course, the obvious eczema and psoriasis, but sinusitis and personality changes and just even fatigue. These are kind of uncommon. Sometimes you wouldn't think that they're connected, especially in teenagers too, things like acne. Then, of course, you have your ADHD kind of symptomology, and kids with learning disabilities can often be traced back to allergies. I can't tell you how often when a parent comes in and they bring their ADHD child to me, already has their diagnosis, and the simplest things we do, like treat their gut and get to their allergies and fix that up, that already the teachers are like, what have you done with this child? They're listening, they can sit still, they can focus, they're learning again. Often, I'd say easily 85% of the time, food allergies.
Food allergies?
Yeah.
So a lot of people know maybe cat dander. They know about ragweed and goldenrod and so on. So when you're talking food allergies and you're talking gut, people are going to be asking that question. What do you mean food allergies? And how does this relate to my gut? How does food interact with my body, my intestinal tract, to give me symptoms, and not these immediate symptoms, but these delayed symptoms that are contributing to my chronic headaches or my eczema and my skin problems? Can you explain that for our listeners?
Absolutely. That's a great question. And you hit the nail on the head when you said it was a delayed reaction. So I often tell my clients, we have think of 3 arms of the immune system. So we have that first one we talked about, that type 1, where you get the hives and you're inflaming and you get anaphylactic right away. That comes from an immunoglobulin in our bodies called IgE. That's, when you go to your conventional allergist and they do the scratch test on the skin, and they're only testing for IgE, and those are pretty obvious when you have them. But then there's 2 other ones, an immunoglobulin in the body called IgG and one called IgA. And they're called type 2 and 3 hypersensitivities, but they're delayed. So, for example, this is what's happening in our gut, okay? We're first line, second line in our gut. So, say you take in a food, it could be anything. It could be a pear, it could be egg white, whatever the case may be. Every single food has an antigen molecular structure to it, a picture that identifies it as an egg versus an orange, right?
So like a fingerprint.
Like a fingerprint, okay. Exactly. And when you have some what we call leaky gut or a dysbiotic gut, where now absorption of nutrients is hampered, but now you've triggered your immune system to proteins that normally shouldn't be in the blood supply. So normally in an intact gut, you digest your food, you absorb its nutrients, elimination, out it goes. But in someone with a compromised digestive system, now we get these food proteins not completely broken down, and they can actually get into the bloodstream where, bingo, your IgG, second line defense floating around your blood says, foreign protein, got to get rid of that. That shouldn't be there. So it's, that's your orange, your egg white, right?
So
what happens is you sensitize now your immune system to something like your food. And then what happens is every time you eat that food, you're creating just a antigen antibody complex, which is basically your immune system attacking a foreign protein, and just a cascade of prostaglandins, which causes inflammation. And once you get inflammation in the gut, it's like a runaway train usually, because you're often not aware those foods you're taking in are creating this chronic inflammatory situation.
Okay, so I want to summarize some of that for our listeners, because I think you really brought something to the light that's going to really help a lot of people. So around your intestinal tract, they say that probably 50, 60, even 70% of your whole immune system lines your intestinal tract. And it's the first line of defense towards food or antigens coming into the body. And somehow, if there's inflammation, for example, if the food comes in and it starts interacting with your immune system, that creates some inflammation. And the intestinal tract, that's usually almost like a closed tube, but some small particles can come through, all of a sudden it gets bigger holes in it. And that's now right. These undigested food particles, undigested other substances and so on, they can get into our blood, and your immune system detects them, and it says, hey, invader on board. It attacks them, and when your immune system's attacking, it creates the signs and symptoms, the inflammation, the allergy, and so on. Is that kind of summarized?
That's a perfect summary. I mean, your immune system's only doing what it's meant to do, right?
Okay.
It's just that gut barrier. And I'd like to say this. In my early training, I had a wonderful mentor, and he was a wonderful doctor that had a lot of German training, and he used to always say this, and I'll never forget it. He says, all disease starts in the gut. That's what the old German doctors used to say. And I tell you, to this day, that it becomes more and more of a truth every year that I practice.
Amazing. All diseases start in the gut.
I mean, with some few exceptions, but I mean, especially, on board since, our food quality has deteriorated terribly. We, the wonderful benefit of breastfeeding has unfortunately fallen out of favor or habit in our culture. So babies don't get that wonderful natural start where they have pre-digested, perfect food for their intestinal system. So they get early introductions of food made in the lab, literally. It has some preservatives and pesticides in it, and they're getting fed often too early for their system to digest it. So there's all this stress creating an unfavorable gut situation that then sets them up for allergies in a huge way.
And so from the start, they're compromised, their immune system's challenged, and that just lets opportunistic bacteria and other things, viruses, just take hold and run them down. So they don't really thrive.
That's right. And I see that a lot. There's been many times where I've had a mother bring in a baby car seat still, and they literally are a failure to thrive. They're oozing eczema all over their face, they're not digesting their food, and they're in big trouble. Yeah.
And so let's take this to, because you specialize and see a lot of children, share with the listeners what you see in terms of with the kids when they come in. You mentioned at the start sometimes learning challenges and not being able to sit still. Can you elaborate on that? And when they come in, what kind of workup or what would a client expect if they came to see you?
Well, what I normally see, the most common things why young children are brought in related to food allergies are a few things. Eczemas, they're the most common.
So skin problems.
Skin problems,
okay.
Rashes and eczemas. The second most common, I'd say, would be for ADHD or learning problems that the school's identified. And then, funny enough, bedwetting. Bedwetting way past the age where that should keep going, right? So past 6 years of age. That's a big one. There seems to be a lot of stress on the kidneys, I believe. So that's pretty big. But sometimes the parents aren't bringing them in for any of those symptoms, and I just, on visual inspection of the child, see these key red flags. And I'd like to explain to your listeners what these key red flags are that you can pick up when someone's still not walking and they're in a chair. So these are the things we look for. Number one is allergic shiners.
What's that?
Some people might know what that is. That's the dark circles under the eyes.
That's not from lack of sleep, necessarily?
Not from lack of sleep. That's right. That's the distinction. Not from lack of sleep. It often comes in pairing with something called Denny's lines, which are little multiple horizontal creases under the lower eyelid. Maybe you've seen it before. These children that look like they have almost black eyes, right? Really dark shiners, and these little horizontal lines. Look, they have all these wrinkles under their eyelid. Those are two really key red flags. Another one is, and you might have seen this on a niece or nephew or somebody one time, where all of a sudden that child's ears turn bright red. Have you ever seen that on
Yes.
Yeah, that hypererythema all of a sudden. That's usually a red flag, and that's usually a response to some phenolic compounds in some foods. But that's something to look forward to. To look for. And then the other one is, at the end of a child's nose, sometimes they have a little horizontal crease on the top, and that's usually because they're rubbing their nose so much because they're so itchy, right?
Oh, what about with ear infections? Because that's a common thing for many parents. My kids had one ear infection, and when I was a young boy, I was actually off school for a month with a chronic ear infection.
Yeah. In taking the history, that's a very, very important part. So we look for things like when you have a high index of suspicion of allergies, the history will be like this. It'll be history of childhood colic often, or recurrent sore throats. So we're always looking for strep or sore throats. And here comes your ear infections, otitis. Children, honest to goodness, if you don't have an allergy to dairy, you probably will never have a strep throat. It's an often common link. So if you have a history of those strep throats, always look to a dairy allergy. It's usually 100% right on with that one. And of course, the recurrent ear infections. I'll never forget. I was moving locations myself, and my daughter, my youngest firstborn, went with her uncle in the truck ride when we were moving, and she got her first taste of dairy, and they went through a fast food place and got some ice cream. First time she's had it. We moved into our new house, and wouldn't you know it, the first night in our new house, she got her very first ear infection. And I couldn't make any rhyme or reason of it, but I had to go through my boxes, find my naturopathic supplements, and treat her. But the next day, I found out that good old Uncle Derek, we'll call him, gave her an ice cream cone, and that was her first initial exposure to it. She had that much of a reaction to it.
So the uncle's trying to be, friendly and nice, and often we reward the kids with maybe ice cream or some sweets. And I guess if you've got these sensitivities, you can't do that.
Yeah, later in my practice, I finally, did my own daughter's allergy panel, and dairy lit up the chart. She was very allergic to it.
You just said one thing there, and our time's always so limited with our clinicians, so I want to, try and extract as much juicy, good stuff and practical information. You said your panel. Tell me about that. What do you mean when you say your panel, your allergic panel? What is that?
Yeah, well, there's different ways to identify food allergies in people, okay? So, and what we do use is, one of the things that we use is a very valuable tool at our office is the gold standard in testing out for IgG and IgA food allergies, which is the gut-related allergies, okay?
These are those long-term ones, the more subtle symptoms, if you will, okay?
Like the ones that when, you consume that food, those, that immune system response could happen from any time when you consume it to like 5 days later. And by the time, you've had 5 days of eating, it's hard to track what food initiated your response, right?
Yes.
So we take the guesswork out of it by doing something we call blood testing. Now, we're really fortunate that science has improved to the point where all we need is a drop of blood out of the tip of a child's finger or toe, and we do something called an ELISA test on them. You can also do an ALCAT test. It's very similar, but this is really measuring, quantifying, and qualifying. Do they really have a true immune allergy to a food, and how badly, how much? So when we do these food panels, we have standard 96 panel food, for example. Prick the finger, 3 drops of blood, dry it on a piece of special lab paper, send it in the mail to the lab. 2 weeks later, we get this wonderful report delineating a full dairy panel.
That easy.
That easy.
Drops
so
of
easy.
blood. You're not taking like the catheter where they take out a couple of those little tubes, and you're just putting the drops of blood on a piece of paper.
So easy.
Amazing.
We used to have to draw blood and spin it down, and believe me, that's not a fun process for any child to go through. But it's become much more cost-effective, less invasive, easy to do, piece of cake. And I really encourage every parent to do it because it really takes the guesswork out of it. In the old days, the standard oldest technique is the elimination diet. You might have heard of that.
Yes, I've done that, and that's a struggle for a lot of people. It's vital and it's really important. However, with that, aren't you just kind of, I'm going to use the word, managing your allergy? You're not really getting to the root cause of it?
That's absolutely correct. And you could say that even for the spot test. It's a place, the blood test that we do in our clinic. It's a place to start to identify, like, so your elimination diets, they're kind of, the standard is you eliminate all the potential top 25 foods you think people might be allergic to, and then you slowly introduce one at a time. But there's a lot of limitations to that. I mean, you can't argue with the results. You eliminate the food, you take it in high doses again 5 days later, then you may get your symptoms loud and clear. Your body will talk to you, but it's really cumbersome and it's really limited. So in our office, we do use the blood test. And we also use 2 other things that we used to do before this blood test was available. One was called AK testing, and your listeners might know this as muscle testing. And we use a lot of practitioners use it. And so when we first started moving from AK testing into doing the blood testing, we always did side-to-side comparisons. So, a practitioner would do their screening with AK, muscle testing with a child or adult, and then we would do their blood test as well. And 95% of the time, it was correlated that what we found on muscle testing was accurate with the blood test. So once we knew that that blood test was reproducible, and we moved on from there just because it's easier and it's faster. And
there you go, in office, quick, easy, and faster. I think parents like those type of things.
Yeah, it's really useful. Now, there's one other third way we help to identify food. I'm going to call them sensitivities, because we should make maybe the distinction between a true allergy, which is an immune reaction to a food, but we also have non-immune reactors we'll call food sensitivities. So this may be things like you're not digesting, say, a component in food like lactose in milk.
Yeah,
so
explain that, because a lot of people don't know and understand the difference between the sensitivity and a true allergy and lactose and the milk issue. Can you explain that? Because I think the listeners need to understand that important difference.
Absolutely. So you have somebody who every time they drink milk, they have cramps, diarrhea, not a good time with it, and they just can't handle the dairy. And so we do their blood panel, right, because we're testing for IgG, IgA immune response, and there's nothing. It comes up really low. Well, when we see that, And when we know dairy is definitely a trigger in the client's history, then we automatically make the pattern there is that they're not digesting likely the milk sugar in milk, the lactose. And then when we give them the right enzymes to support that, they can often then consume their dairy without any consequence. But people can also react to preservatives on foods, even natural elements in foods, like natural phenolic compounds in foods can trigger allergy. It could be from the fungicides or the sprays on foods. It could be from the natural coloring even in fruits and vegetables.
And some kids and children are sensitive to, say, the red dye is very popular for allergies.
So, yeah, and so you have to look for that. And you have to tease that out and see, do we have a true immune response? Or sometimes we have both. We often have both, actually. Mm-hmm.
Interesting. Mm-hmm. So when a person comes in, the mother brings in the child or the dad brings in the child, you do these different types of workups for maybe some blood testing, some of this muscle testing, and so on. What happens after that? Do the parents, because I've heard this concern that parents think, oh my gosh, I'm going to have to cut out every food under the sun. This is going to be brutal. I'm going to be cooking all these different meals, all these special meals. In reality, what has your clinical experience these last 19 years taught you about this?
Well, they were a big line for learning, I'll tell you that. It was frustrating for me, too, because we could identify all these allergies, and they were a for sure deal, whether we did it through the blood test or whether through AK testing or even electrodermal screening, which is a medical device that we
Oh, you never mentioned that. Sorry
we never really got to that.
Could you tell us about that? Because that's a really cool technology.
Right. So we'll back up. So we actually do electrodermal testing, and it's otherwise known as something called EAV, which really stands for electroacupuncture according to Voll. And Dr. Voll was one of the pioneering, brilliant German physicians, and he was an engineer too, who discovered that there were small, very precise, measurable fluctuations in skin resistance and flow of current in the body at acupuncture points. So we have his tool called an EAV device to it's like a little probe. You just press on the acupuncture points on the knuckles and on the toes.
So it doesn't go into the skin, it sits on the skin.
It's just reading electrical potential. There's no electricity felt at all. But it's an amazing tool to determine the stress on an organ system associated with an acupuncture point.
Wow.
But we don't, and I have to stress, don't diagnose allergies from that, but I can really tell from a pattern of a really strained gut immune system, and on the allergy readings, I'm getting lots of sensitivities, lots of inflammation. I know that for sure I can say we have some sensitivities happening, but then I know it's a true allergy when we do the blood test and then we see those results. But whether or not it is a full, true-blown allergy or a sensitivity, both ways it has to be dealt with, right?
Yes.
To get that person to where they want to be for health, yeah.
And just speaking of technology, when I was in your clinic and you're showing me around, one of the things we were discussing is that often when people have allergies, they get inflammation, and often they get a lot of water retention or edema, and you have some equipment that can measure like body fat and muscle and fluid. Tell our listeners about that, please.
Yeah, that's a wonderful little amazing non-invasive quick machine called the Bioimpedance analysis. Basically, we take the height and weight of somebody, put a couple little stickies on their feet and their hands, and we can measure their body compartments, we'll say, of body lean, body fat, body water. And then we can also distinguish between intracellular and extracellular water. So, that's actually a good thing you brought up, because adults, sometimes one of their main symptoms of food allergies is not the standard itchy, hivey, gastric upset. It's that they can actually fluctuate weight 2 to 3 pounds in one day due to fluid.
Really, that much weight shift?
Yeah, due to fluid retention. And you see this so much with women, in their mid-years, where they're bloating, they're just holding so much water, and they go on the diets and they just can't seem to get the weight loss that they want. But when you take in a food that you're intolerant to, and then you get the inflammation going, fluid starts to enter extracellular spaces, right? It makes you edematous. And fluid retention's weight gain. We take the most two common things, so easy. Take somebody off of wheat and off of dairy, and you can just see the weight loss start just by that.
And often that's fluid retention.
It's fluid retention in particular.
And they lose that puffiness and all that edema, and they just start feeling better.
Well, they feel better also because their gut's not inflamed anymore. And that's the big piece. Their moodiness goes away, PMS goes away, even depressive symptoms. I have seen, this is like a miracle for some women. They come in on antidepressants, and a lot of people are on anti-anxiety, antidepressant medications. And their gut is really inflamed. They're loaded with allergies on testing. We get them off their allergens 50% of the time. Their depression goes away. There's no more need for Effexor, any of those SSRIs. It's quite miraculous.
That knowledge really needs to get out to the public more, that we know things like chronic stress can reduce the feel-good hormones in the brain, but this allergy connection, many people don't know that, and the depression and maybe it's not full-blown depression, maybe it's just kind of low mood, maybe it's just not a cloudy day instead of a rainy day, full depression, and that can run people down, and that reduces the quality of our life. And I guess one of the great things that I've learned about naturopaths over these years doing these interviews is that it's the improvement in quality of life, that the holistic care can really just do incredible things, because you learn to get to the root cause, the underlying causes of these chronic illnesses.
I couldn't have said it any better.
Oh, well, thanks.
The root cause of illness is where you want to go, because that's when the body truly gets cure. You're not shifting a symptom. You're not covering a symptom. You're not helping the body compensate to a symptom. You're fixing the problem, right?
That's great. Wow. I love to learn all this stuff.
Very rewarding to do that. Very rewarding.
Yes. Are there other aspects of allergy that you would like to share that you think people need to know?
Yes, I would. It's I don't know if you can remember, or you probably can remember, Robert, going back to when you were in school. Do you remember any of your peers, your friends at school having any allergies? Was this a big thing back then? Can you remember?
I can remember one kid who got allergy shots.
Right.
No, they went for needles.
Ragweed or dogs or cats or something, right?
Yes.
But in regards to a lot of anaphylactic reactions to foods or food allergies, did you ever hear anyone say, "Oh, I'm allergic to dairy. I can't have dairy"?
Well, actually, in the school I was in, I was the only kid. I'm anaphylactic to nuts.
Oh, there you go.
And when I was a kid, my mother didn't even believe this, actually. Up until I was about 30 years of age, she did not believe that I was allergic to nuts. And so, no, in schools, we didn't see allergies, and kids didn't wear glasses, just the odd one. However, things are different now.
They're very different. Epidemic, truly epidemic. And I know I do see a select population, parents bringing children to me already with problems, but easily 90+% of the children in my office have, verifiable allergies. And so how is this happening? Every mother goes, what did I do wrong? I did everything right. I had a healthy pregnancy. But you know what? It's hard to be healthy on such a toxic planet. Let's face it. Our industrial chemicals, all the exposures we have out there are weakening our systems as it is and are a stressor. But I really want to get back to this food. The processed crap, literally, in our food and chemicals is really doing a disservice to our intestinal system. So I really advise, for generally, especially when a woman wants to start a family or is already pregnant, to bring their diet back to the purest form that it's meant to be. So eat food, very simply, closest to nature intended it to. Avoid the processed foods and packages and boxes and things wrapped in, in boxes with plastic liners and these sorts of things, and start cooking from scratch. Now, if you happen to know you have a family history of allergies, or you think you have allergies, especially if you assess your own digestive capacity, my advice to pregnant ladies is please avoid your allergens so that you're not putting that kind of immune stress on the fetus. And
Good point.
when women do avoid their allergens, their children, the baby is less likely to be born with allergies. And I tell you, we do something called live blood analysis at our office, which is taking
yet another test. You guys have such a huge range of comprehensive services. It's amazing.
Yeah, we really try to be eclectic and comprehensive, but it amazed me the very first time as a young practitioner. I took a drop of a baby's blood and put it under the microscope. A baby, we're talking like less than a month old, who should be healthy, starting life fresh. I looked at the baby's blood and was horrified at how toxic and stressed it was and how much immune stress I saw under that live blood cell analysis. Then I proceeded to take the mother's blood and did a comparison. That baby's blood looked exactly like the mother's, and no doubt because, of course, they share the same blood supply for 9 months. So therein is the important message. Mothers, what you eat, what you're exposed to, what you do, how you think, everything that you do in pregnancy is going to affect that baby. So I really implore to really be careful and eat a whole food diet. So you may want to consider, okay, let's take the top allergies that are often come up. We got eggs, we got dairy, we got gluten or wheat. Or gluten is a allergen found often in wheat, but it's also found in rye and barley and spelt and kamut and those kind of things. So if you bare minimally either take those out or minimize them while you're pregnant, you're going to have a far healthier child, less chance of allergies for sure.
Awesome wisdom. I love to hear it. So, our time's running down, but I thought I would just ask for any last comments on things that you would love to share with our listeners. This has been a wonderful conversation, by the way. Thank you for sharing.
I've had great fun. I guess what we should do is wrap up with then how do you treat? Like one of my biggest frustrations in practice the first 10 years was I could identify all these, but having someone to avoid, say 12 of their major favorite foods is a challenge, right?
Yes.
And it's hard to think that I'll never be able to eat oranges again or never have a drop of gluten or dairy, and it becomes a burden to them. So so we used to do elimination diets and rotation diets and things like that. But number one is we have to heal the gut. We have to heal the gut so we stop stressing and triggering the immune system as best as we can. We call that a gut reinoculation program. It can involve anything from antiparasitic, anti-candida work, and lots of gut healing supplements to just get that leaky gut fixed up again. So that's number one. You don't even go any further till that's fixed. But we at our clinic also have a wonderful, wonderful technique called BIE. It's short form for bioenergetic intolerance elimination. And this was a wonderful find. It basically takes, again, what I'm trying to say is Chinese medicine, right? Ancient Chinese medicine using acupuncture points and the allergen. While you have the allergen that you're allergic to on a test plate, we stimulate certain acupuncture points, and what we're doing is we're re-educating your immune system response to those foods so it doesn't inflame. And, I was pessimistic when I first heard about this, and in the earlier days there were versions of that, but nothing that ever got me to pay attention because they weren't consistent. But we spent a lot of money to get training in this wonderful technique, and it's honestly, Robert, it's short of miraculous here. We get people that used to not be able to take a drop of dairy or even a molecule of peanut, much like yourself. And through a series of these treatments with BIE, they've been able to consume their offending foods. Now, we always tell people don't go crazy, everything in moderation, and keep your body healthy, keep your gut healthy, and keep your stress down. And usually those corrections hold, but a new lease on life. That's all I can say. These people are so happy. They often go, I'm a poster child now for your clinic, because they used to go through boxes of Kleenex, or they used to have to know where all the washroom stops were along the way on a long trip because they had such bad gastric responses, and now they got their life back, really.
That is wonderful to hear. Just as you've been speaking, I was just thinking how comprehensive your services and your programs are. You have the allergy testing, you have the live blood analysis, you've got the body composition with the BIA testing, you can look at allergy with EVA testing and this BIE testing, you can do the muscle testing, the AK testing, you guys do the diet analysis, you can do inflammatory panels. Like, this is amazing how comprehensive your services are. Like, this is so unusual in this day and age to have someone, instead of being a true specialist in one tiny little area, you're looking at this big picture, this holistic approach at the person, at the body, that's why I guess your clinic gets and has the reputation for getting such awesome results.
Thank you. Thank you very much.
Well, our time is pretty well run out. I just want to say thank you for sharing your wisdom and your clinical insights with us. This has just been wonderful, and I truly hope our listeners take advantage of your services and your clinic. And I should ask, do you have a website? Is there a name for your clinic that you'd like to share?
Yeah, we have a website. It's Sunrise Health Services, and you can find us at .com.
So Sunrise Health Services.
Sunrise Health Services. And you can just Google us, and we'll pop up there. We have 4 doctors in our clinic, a nutritionist who does our allergy work, massage therapist, and we have a pretty lovely place going. And I was just thankful for this opportunity today to share this critical information, because, rather than these poor children struggling for years and years and years and not doing well in school and their health being unwell, that if parents can even know what signals to look for, come in to see a naturopath, help get better, that's a gift. It's a true gift.
It's all good. Well, Dr. Cormier, thank you for sharing with us today. This is a real blessing for us, and I look forward to speaking to you soon in the future.
Thank you very much, Robert.
Bye for now.
Bye-bye.